Welcome to the Swedish General Surgery Residency Program. My name is Dr. Glenda Kwan, and I'm proud to be the Associate Program Director. Our residents have put together a video to give you a feel for what Swedish has to offer and what life is like here in our residency program. We hope you enjoy it, and I look forward to meeting you soon.
My name is Michael Davitt. I'm a third-year general surgery resident here at Swedish. Swedish Medical Center is a 400-bed tertiary referral center with a catchment area that includes Colorado, Wyoming, Nebraska, Kansas, New Mexico, and even South Dakota. This is a level 1 trauma center as well as a burn and stroke center of excellence. Needless to say, we're equipped for all the high acuity and emergency care that's needed. Let's go for a tour.
Hey, I'm Samantha Greenside, and one of the second-year residents here at Swedish Medical Center. The Swedish General Surgery Residency Program is a community-based surgery training program based in the Denver, Colorado metro area. The program is centered at Swedish Medical Center, which is a 400-bed hospital that has been providing care for the South Metro Denver community for over 110 years. As part of the HCA HealthONE network, our residents have access to all of the resources of the 6 HCA hospitals in Denver. Our program goal is to graduate confident, well-trained surgeons who are prepared for general surgery practice or competitive for fellowship training. Trainees will get ample experience in general surgery and also a wide variety of surgical subspecialties, including hepatobiliary, pancreatic surgery, breast surgery, colorectal, transplant, burns, plastics, cardiothoracic, vascular, pediatric surgery, trauma, and all other surgical critical care.
This is the main OR. We have 27 operating rooms at this hospital, and residents are expected to participate in all of the operative cases. For example, first-year residents will do skin and soft tissue cases, appendectomies, and cholecystectomies. Junior residents will graduate to more complex robotic and laparoscopic surgeries, mastectomies, bowel resections, and vascular bypasses. Lastly, the chiefs are expected to perform a wide variety of complex operations and given the opportunity to do so with more autonomy as well as teach. Now let's head over to the emergency department.
We have 15 residents in our program, 3 residents per class, comprised of MDs and DOs from all over the country. Now let's head into the ER. Our emergency department experiences about 90,000 patient visits per year. Surgical residents come to the emergency department for trauma alerts and activations and to see acute care surgery consults. We have 5 trauma bays that are fully equipped with rapid transfusion equipment, high quality ultrasound, as well as everything you might need for intubation, chest tubes, lines, thoracotomies, and more. Our hospital is uniquely structured to streamline care to the critically ill or injured patient. The emergency department, CT scanners, operating rooms, and ICUs are all on the same floor to facilitate these critical transitions of care.
Welcome to the multi-trauma unit. This is our intermediate care and step-down unit at the hospital. This is where we conduct multidisciplinary rounds with PT, OT, dietary, case management, and our trauma charge nurses to optimize patient care. It looks like we have a trauma activation, so I'm going to hand you off to Dr. Backen.
Thank you, Dr. Davitt. My name is Timber Backen. I'm a first-year resident here at Swedish Medical Center. This is the multi-trauma unit. As an intern, we spend 4 months on our trauma service. This service allows us to develop our knowledge base and our medical skills, as we're the primary physicians for both traumas admitted from the emergency department and also those traumas transferred here from outside facilities. This service allows us to begin operating and performing bedside procedures early on in our residency career. We also work very closely with surgical subspecialties, including orthopedics, neurosurgery, oral maxillofacial surgery, plastics, and vascular. Now let's head down to the general surgery floor.
I think that over here.
Welcome to the general surgery floor. As residents, we care for patients with acute surgical issues, such as acute cholecystitis and appendicitis, small bowel obstructions, GI perforations, and so much more. We work closely with medical doctors as well to optimize our patients' care. Now it's time to visit our surgical ICU. One of my favorite things about residency here at Swedish is the culture. I feel extremely supported by both my attendings and my co-residents. Another perk of the program is that we have free parking, which is covered in the wintertime.
This is our surgical ICU. This is where we take care of critically ill trauma and surgical patients who need a higher level of care. As a general surgery resident at Swedish Medical Center, We manage the critical care needs as well as any surgical issues that may arise. We perform life-saving procedures, including bedside laparotomies, central lines, arterial lines, intubations, as well as tracheostomy tubes and PEG tubes. All right, now let's head over to GI rounds, also known as the cafeteria.
Here's the cafeteria. There's usually an array of both hot and cold foods available for free of charge to residents. One of the benefits of living in Colorado is that there are always healthy options to choose from. And speaking of food, I'm going to grab some now before I head off to a case. I'll hand you off to Dr. Greenside to finish the tour.
Thanks, Dr. Backen. Here we are at the Residence Lounge. This is typically where we hang out and write our progress notes for the day when we're not interacting with patients. In addition to numerous workstations, we also have a call room for night call or 24-hour shifts. Here's our surgical library with a wide variety of up-to-date surgical texts. The Resident Lounge is usually where we hold didactics, although the location changes frequently to nearby conference rooms to adhere to social distancing guidelines. All right, let's head over to the simulation lab. Welcome to the Surgical Residency Simulation Lab. This is where we practice our surgical skills, including knot tying and suturing. We also have a state-of-the-art FES simulator where we practice our colonoscopy and endoscopy skills. We have PEG and tracheostomy kits, central and arterial line kits to practice with as well. This is our FLS simulator that we use to practice laparoscopic skills. We do get a lot of operative experience here at Swedish, and this is a great place for us to supplement our surgical skills training.
So that wraps up our tour of the General Surgery Residency Program here at Swedish Medical Center. Thank you for your time, and we wish you the best of luck this year with your applications. If you have any questions at all, you can reach out to our program coordinator, Gina Brooks. Thank you.